Hello, my name is Yvette Selesky. I'm a registered dietitian and marketing manager for Hormelhealthlabs. I have been working with clients and healthcare professionals serving the dysphagia population for over 15 years. Hormelhealthlabs has been proud to offer foods, beverages, and specialty items to the healthcare market for the past 25 years, and more recently for those individuals cared for in the home. We are committed to providing great tasting, innovative products that make life safe and more simple for a patient or their caregiver. A major segment of the products we offer are designed for patients suffering from swallowing difficulties. This is also known as dysphagia. These products allow individuals with swallowing difficulties to enjoy their favorite foods and beverages without the risk of medical complications and the unintended consequences of malnutrition or dehydration. What I hope to provide for you today is a brief overview of the normal swallow process, explain dysphagia and who can be impacted by dysphagia, and texture definitions as outlined by the National Dysphagia Diet guidelines. Many times, dysphagia is secondary to other serious medical conditions. Patients or their caregivers are confused by the myriad of medical needs necessary to manage their multiple medical conditions. I will provide you with the tools to support them in making the appropriate selections for assisting in the management of dysphagia and taking the mystery out of the dysphagia diet. Please take a moment to familiarize yourself with the questions on the Test Your Knowledge quiz prior to the start of the presentation. Under normal circumstances, we swallow approximately 600 to 2,000 times per day without thought or effort. Millions of Americans suffer from some degree of swallowing difficulty or dysphagia. It affects up to 40% of the population in long-term care facilities and 15% of independent living adults. For people both young and old suffering from dysphagia, the effects can be devastating, both emotionally and nutritionally. When a patient stops eating due to their diagnosis or eats food not properly prepared, it can even be life-threatening. To fully understand the importance of thickening foods for people with swallowing disorders, it is important to understand how swallowing works. I've included a diagram of the parts of the mouth and neck involved in swallowing, and I will show you a video clip of the swallowing process in action. I encourage you to follow along using the same swallowing actions described. Swallowing is a complex process. Approximately 50 pairs of muscles and many nerves work to receive food into the mouth, prepare it, and move it from the mouth to the stomach. This happens in 3 stages. During the first stage, called the oral phase, the tongue and jaw move solid food around in the mouth. It is prepared for swallow by breaking it down into the right size and texture by mixing it with saliva. The second stage, or pharyngeal stage, begins when the tongue pushes the food or liquid to the back of the mouth. This triggers a swallowing response that passes the food through the pharynx or throat. The larynx or voice box closes tightly and breathing stops to prevent food or liquid from entering the airway and lungs. The third stage, or esophageal stage, begins when food or liquid enters the esophagus, which is the tube that carries food and liquid to the stomach. This phase only takes 3 seconds. Now, what happens in the swallowing process when a patient experiences dysphagia? Dysphagia can be caused by weak, uncoordinated muscles involved in the swallowing process, poor chewing skills, lack of or ill-fitting dentures, poor sensation in the mouth or throat, and delayed reflexes that don't allow protection of the airway. It can be a temporary condition or require treatment for the duration of the individual's life. 2 of the biggest concerns when someone has dysphagia are aspiration and choking. Aspiration means that food or drink has entered the airway. This will cause difficulty breathing, can lead to pneumonia, and can be fatal in severe cases. Choking is when a large piece of food gets stuck in the airway and the person immediately is unable to breathe. Dysphagia may be related to a wide range of neurologic disorders, degenerative diseases, psychiatric, respiratory diseases, and other medical conditions. So who is affected? 40 to 60% of stroke patients present with dysphagia. 24 to 34% of 85-year-old individuals with Alzheimer's disease. The normal aging process results in decreased function of esophageal reflux and decreased saliva production. 29 to 77% of cancer patients being treated for dry mouth. Dysphagia is a common side effect of medications. Other medical conditions are multiple sclerosis, Parkinson's disease, traumatic brain injury, Huntington's disease, Lou Gehrig's disease, cerebral palsy, obstructive lesions or tumors, gastroesophageal reflux disease or GERD. Just as there is a wide range of causes, there are wide ranges of treatments. These include changes in positioning, modifications in the consistencies of foods and liquids, and techniques that alter the way a person swallows. A physician and/or speech-language pathologist recommends a change in the consistencies of foods and liquids based on the National Dysphagia Diet guidelines. We are going to discuss these guidelines further. In 1989, a group of speech-language pathologists and dietetic professionals set out to improve the quality of life for patients with dysphagia. It was recognized that the previous diet descriptions were too confining and limited diet consistency advancement as a resident's swallowing improved. From this study, 3 textures were defined: dysphagia blenderized pureed, dysphagia mechanical, and dysphagia advanced mechanical. Liquid consistencies were defined as thin, nectar thick, honey thick, and spoon or pudding thick. A practice group of the American Dietetic Association developed guidelines for the National Dysphagia Diet based on this initial research. The multidisciplinary task force reviewed and tested over 200 diets and included food scientists, clinical and consulting dietitians, speech-language pathologists, and representatives of the food industry. The new publication, The National Dysphagia Diet, Standardization for Optimal Care, is used as the industry standard. The standardized diet consistencies and general guidelines are Level 1, or dysphagia pureed. Please note there are 3 levels of the dysphagia diet recognized, but we will only discuss level 1 as our thick and easy puree best meets the requirements of this diet order. Please also note these products are acceptable for a level 2 diet. This diet consists of pureed, homogeneous, and cohesive foods. Food should be pudding-like. No coarse textures, raw fruits or vegetables, no oatmeal or unprocessed wheat bran stirred into cereals. Any foods that require bolus formation, controlled manipulation, or mastication are excluded. This diet is designed for people who have moderate to severe dysphagia with poor oral phase abilities and reduced ability to protect their airway. Close or complete supervision and alternate feeding methods may be required. Liquid consistencies are also defined in the National Dysphagia Diet publication. The terminology is standardized as thin, nectar, honey, and spoon or pudding thick. Viscosity measurements are supplied in centipoise. I will demonstrate for you what each of these liquids looks like. Nectar consistency is commonly described as tomato sauce-like, and both honey and spoon or pudding thick resemble those foods. The purpose of thickening foods or drinks is to allow the muscles to move it slowly and easily for swallowing.